Right, so we all know how bad it is trying to get a GP appointment these days, don't we? Numbers have been falling steadily since 2015, 2,000 fewer GPs now than we had then, despite a pledge to increase them by the Tories. But we all know what their promises are worth, don't we? But for those GPs persevering in the service, it's becoming ever more difficult. And the great hope many had that a Labour government would fix things and enable them to get back to what they entered the service to do, to look after us when we're ill in our communities, have been dashed, courtesy of Red Tory Wes Streeting. Yes, him again. Streeting, in an article to the Murdoch Times, again, so stashed behind a paywall, hidden away, and laughably with a tagline that he wants to take on vested interests. Come off it, they donate to him. Streeting states that he wants to get rid of GP practices, though. Right now, most GP practices, in case you weren't aware, are run by a group of partner doctors who will often end up taking out a large mortgage between them to buy the building, the equipment, to get it all set up and running. And that's a massive long-term personal commitment, as I'm sure you can appreciate. They're heavily indebted to themselves in order to deliver community medical care, as well as be employers as well to other staff, like salaried GPs or nurses, a practice manager, for example, and still be GPs themselves as well. This is what it takes to make a practice operational. But under a Streeting-led health service, that would be abolished, and all GP partners would become salaried NHS workers, equivalent to their employees, on half the wage. So, Wes, how are you going to compensate them for their own personal investment in a practice they themselves set up and run then? In other words, how much is this blatantly unworkable, insulting and uneducated crackpottery going to cost us out of the public purse to buy out all of these GP partners all across the country? He hasn't mentioned that, though, has he? Has he even thought about it? I doubt it, because he has no health experience whatsoever, has no clue what he's doing, no experience in anything functionally. He's a straight into politics careerist with no healthcare knowledge except as a patient. And boy, does he use the fact he was treated for cancer on the NHS as some kind of divine insight into how to fix it. It's laughable, really. He'd have to nationalise GP surgeries, when ironically they're one of the few things that work perfectly fine as independent practices operating within a national health service. He wants more private provision to bail our NHS out of the mess the Blue Tories have left it in, yet not if it's GPs. Perhaps if they donated to him, he'd think differently. God knows he seems to take money from anyone, but especially private health interests. In fact, if Wesley sneers it won't cost the public a penny to do this when he eventually catches up and realises how much this will cost, perhaps it's the private sector he'll allow to just swoop in and buy them up instead. His donors will have been well rewarded then, won't they? And don't think it won't happen either, because it already is. GP practices, by the very nature of how they come into being, can be bought and sold just as easily as any other business. And the Tories have let a significant number of GP surgeries get bought up by, for example, US health insurance types. Just last year, AT Medics, a chain of some 37 GP surgeries across London, were bought out by a conglomerate called Operose Health, who are themselves owned by the Centene Corporation, a US health insurance group. A US health insurance giant is now running GP surgeries here in the UK today. More of that to come, or similar, Wes? Some GPs' social media have pointed out they love the idea of working set hours, get their set holiday allocations, as they would if they were NHS employees, effectively. But equally, they pointed out that the service isn't full of people who entered it for the pay and conditions. Those who set up practices certainly didn't when they put so much of their own money on the line, but as a vocation, because they care about their patients, and as such, a significant amount of unpaid work gets done by them, admin, etc., that would no longer get done under these new terms. And actually, this side of thing has led to many practices closing down already under the strain of it all, with GP partners unable to find enough hours in the day anymore to keep their businesses afloat. That is entirely a consequence of underinvestment and underfunding, because our local GP surgeries, although set up as businesses, operate entirely within the NHS. And they've been starved of the means to keep going. No fault of their own, their business model is what it is, NHS dependent. One estimate I read reckons for every GP partner that gets abolished under the current system, they'd have to recruit 3 salaried GPs to get the same amount of work done. Where are they going to come from? It takes on average 10 years to train a GP because of the breadth of knowledge required, and the wages being halved isn't going to prove much of an incentive either. He also wants pharmacists to take on a bigger role, more of the vaccinating, more prescribing themselves. But hang on, these people, as clever and knowledgeable as they are not a replacement for doctors or GPs, and the prospect of things being missed surely would increase. Proper Tory policy it is, coming from a red Tory MP, privatise all the way. There really is nothing Labour about this guy. Functionally, Streeting doesn't get how GP partnerships work. Perhaps instead of speaking to Rupert Murdoch's hacks all the time, he might talk to some actual GPs instead, who might educate him, might explain it to him. Pin your ears back and get into listening mode, Screechy. He can also explain why he feels it's appropriate to refer to GP practice as a murky world, as he did in that article. That's encouraging to staff, isn't it? You murky GPs, you. Wesley's genius didn't stop there, though. He wants you to be able to take some of the work off GP's shoulders as well and be able to self-refer yourself to secondary care, to hospital for treatment, because they aren't overrun at all, are they? How many people will see a strange rash and instead of going to the GP as your first port of call, you just refer yourself straight to a dermatologist? That curry you had last night that did its wicked work, but being the paranoid type, maybe you opt to go straight to the gastro team. Maybe the hospital is closer than the GP, so you just save yourself a walk. Maybe you think you're saving your overworked GP some work, but no matter how altruistic you're thinking, it's not the way things are meant to be. You can see how stupid this idea is and how open to abuse it would be and how harmful it would be to people genuinely in need of secondary care, stuck in a queue behind others who should be at the GP instead. Self-referral is incredibly stupid, Wesley, even for you. But above all else, as far as the Labour Party and its health policy goes, as a statement from the Socialist Health Association released today stated, none of this is agreed Labour Party policy. Policy decisions get made each year at party conference, and health is always a biggie on the annual agenda. But we also know that under Starmer's dishonesty and authoritarianism, what conference says is secondary to what he and his hangers-on like Streeting want these days. At conference last year, it was passed unanimously that Labour would adopt a position of outright opposition to and commit to vote against any and all forms of privatisation of the NHS and commit to returning all privatised portions of the NHS to public control upon forming a government. It also banned Labour MPs from accepting donations from private companies interested in outsourcing NHS functions. That'd be your donations from John Armitage and Martin Taylor out of the window then, wouldn't it, Wesley? It is wrong to say the private sector has the capacity to save the NHS because it doesn't. It is wrong to say the private sector is more efficient because it isn't, as Tony Blair's PFI initiatives proved, which cost the public purse £80 billion when it only invested £13 billion. We don't need round two of that. With staff shortages such as we have, how can they be stretched between private and public provision? Because public provision will always therefore suffer. Streeting's referral to GPs as murky is hardly surprising because he's as rude as he is out of his depth. He's called the health unions like the BMA hostile towards Labour plans, and so they should be. Then, of course, he called Jeremy Corbyn senile the other week, caught on a parliamentary mic. A small digression from the topic at hand, I appreciate that, but it all shows what a deeply unpleasant creature Wes Streeting is. He's not operating in our interest because he's getting paid more by private health and dark money shell companies as MPM Connect, who gave him £60,000 seems to be. His latest dodgy donor scandal, all far outweighing his parliamentary wage. We deserve a full refund of that because he doesn't even work for the wishes of his own party members, let alone the rest of us in the public.